invite you to.
Great, thanks, Nicole, and for the introduction. And I do remember that I used to have the pleasure of teaching the guest lecture in May's cultural psychology section on access to care and models of access to care and inequities in access to care. So appreciate that, and appreciate you all having me today and everybody taking the time, and to Kira for coordinating and kind of helping me get this all up and running. So thank you all. All right, so I'm going to share my slideshow, and I'm going to make sure I can see people at least a little bit. So you all can see my intro slide, I presume?
Yes, looks great.
Okay, great. Okay, so my title of my talk is Measuring the Engagement in Community Engaged Research. Are we truly empowering the community to inform behavioral health equity? And so just to set up the conversation a little bit, this is, I have a current project, and I'm going to talk more about the project, but it's funded by the County of San Diego Behavioral Health Service System to really facilitate system-wide community engagement. And the idea behind that is the community input that's gathered as part of this system-wide community engagement process is used to inform behavioral health services program and policy. So ultimately, right, community engagement informs behavioral health decision-making through the evidence that's co-created in community. In collaboration with several people who are on this call, so thank you for being here as well, and just a really great group of partners, we proposed an innovative community engagement approach to do this system-wide work in San Diego, and that was funded by the county. But there's been no requirement to measure the effectiveness of that approach, and this is something that I've been thinking about quite often in the work that I've been doing in partnership, and I've been doing for folks that have known my work for a little while. It's largely been situated in the child welfare service system and in collaboration and community partnership for quite some time, but really kind of started to center around and thinking about what are the systematic ways we should be thinking about measuring engagement to know, are we including community in ways that actually improve health equity? So that's kind of where we're going to go today. So I have this naturally occurring opportunity to what I hope is overlay new science on this innovative approach that we've put in place here in the County of San Diego, with the idea of really using community engagement to inform system improvement and community outcomes. So there's a currently funded study I'm going to talk a little bit about, and then really thinking about how do we overlay a research study on top of that to measure the impact of the work. So that's where we are. So what I'm going to do today is our roadmap is I'm going to talk really briefly about health equity and implementation science. I'm going to spend a little bit of time on the community engaged research principles that lay the foundation of the work that we're doing. I'm going to talk about CERI, that's the acronym for our project, the overview and the aims of the actual funded work. And then I'm going to talk about measuring community engagement under this advancing the science of engagement call for funding call. And then save some time for challenges in this work, discussion with the group, whatever may emerge. So I think I have about 30 minutes prepared, which should leave us about 15, 30 minutes, depending on who has to kick off at 3 o'clock, to have a nice discussion. And I'd say too, if there are like clarifying questions along the way, please feel free to put them in the chat. And I think Kira is going to help me monitor those, or maybe Nicole as well. If you have these larger thought questions that kind of come up, I would encourage you to just kind of hold those to the end and have a robust discussion at that time. So health equity and implementation science. Advancing health equity and eliminating health disparities is increasingly an overt goal of implementation scientists, though it's been a foundation of the field since its inception, right? It's the whole idea of how do we get evidence to communities in meaningful ways to affect positive change for communities who have typically been historically minoritized or facing structural disadvantage. So when we talk about it here, and the approach that underlays the work that I'm presenting is this an explicit and intentional integration of intimate implementation science and equity, so framed from the very beginning of the work. Similarly, community engaged research has been a central feature of implementation science from its inception, though we have called it many different things. One foundational systematic review by Drahoda and colleagues in 2016 recommended consensus around using the term community academic partnership to unite research disciplines and more systematically advance the field. And most of my work has been situated around this term until recently. Then we also the implementation science field has specifically, goodness, I have like the driest throat, had as term its own specific approach of community engaged dissemination and implementation research. So what that is, as defined by Holt and Chambers, we already mentioned David Chambers, research involving dissemination or implementation of evidence-based health interventions within clinical or community engaged, clinical or community-based settings, using community engaged processes or partnerships, including but not limited to community-based participatory research. So there's another one we're invoking. Emphasizes engagement of stakeholders, that could be community members, practitioners, community organizations, etc., with diverse experiences, perspectives, and expertise to provide key knowledge regarding a local context, priorities, needs, and assets. And ultimately incorporating unique perspectives from communities which have been historically excluded from the research process. So that's how we're defining community engaged dissemination and implementation. I italicize stakeholders here because I just want to note stakeholder is a phrase that's been so commonly used and is used everywhere, and I've actually moved away from using it. So you'll see as I kind of move forward in my language and in the work, just learned a lot about kind of some of the contention around it's deeply rooted in colonial practices. So I personally moved away from its use, though you'll see it come up quite a bit in a lot of the calls. So this just, again, situating us in this idea of, I'm going to continue to talk about community engaged research as the paradigm, but all of these approaches are aligned in here, right? So we see that community engaged dissemination and implementation, community academic partnerships, community-based participatory research, participatory action research and youth participatory action research, and research practice partnerships. So all these approaches have similar intent of including community in meaningful ways in our research process, and then they each have some unique components. So I'm just kind of situating any one of these approaches within this kind of idea of community engaged research. So if we're really going to do community engaged dissemination and implementation research, the Centers for Disease Control and the National Institutes of Health have identified 9 principles of community engagement to assist researchers and community collaborators in the engagement process. They categorize them into 3 domains: the key components to consider prior to beginning engagement, those necessary for engagement, and those for engagement to be successful. So I'm going to walk through these because I think it's an important foundation. So the first one is be clear about the purpose and or the goal of the engagement effort and the populations or the communities that you want to engage. Know your community. Becoming knowledgeable about the community's culture, economic conditions, social networks, political and power structures, norms and values, demographic trends, history, and experience with efforts by outside groups to engage it in various programs. Learn about the community's perceptions of those initiating the engagement activities. This has been something that's been so foundational to my work in the last 5 or 6 years here in the county of San Diego, and really, really important. That needed for research, go to the community, like literally go, establish relationships, build trust, work with formal and informal leaders, and seek commitment from community organizations and leaders to create processes for mobilizing the community. And then collective self-determination. Remember and accept that collective self-determination is the responsibility and right of all people in a community. No external entity should assume it can bestow on the community the power to act in its own self-interest. The last 5 principles are all in the succeeding in the engagement process domain. Community partnerships are vital, necessary to create change and improve health. All aspects of community engagement must recognize and respect the diversity of the community. Awareness of the various cultures of the community and other factors affecting diversity must be paramount in planning, designing, and implementing approaches to engage in the community. The 7th one, community engagement can only be sustained by identifying and mobilizing community assets and strengths, and by developing the community's capacity and resources to make decisions and take action. Maintaining flexibility. We want to do this in community and authenticity, We must be willing and prepared to release control of actions or interventions to the community, be flexible enough to meet its changing needs. And community collaboration requires long-term commitment. So again, I share these because I really want to root what it means to have authentic community engagement centered in our studies, because that's what we're going to talk about doing, and what I'm going to talk about trying to measure and doing so in meaningful ways. And also want to kind of acknowledge that the principles here recognize and appreciate that all who are involved in engaging a community must be responsive to the needs of that community as defined by the community itself. That's my setup. Here we have community empowered research to inform behavioral health equity, CERI, the acronym that we're using here in the County of San Diego to be doing this community engagement work at this time. And so you see that acronym a couple times in my slides. What CERI is a community partnered collaboration centered on a comprehensive approach to community engagement for behavioral health equity and inclusion. It's a partnership with the Community Health Improvement Partners and the Global Action Research Center. I'm really glad Paul is here today to kind of help guide the back end discussion, if you will. It's funded by the County of San Diego Behavioral Health Services System, and it's predicated on full community involvement at all phases of the project. So what I mean by that, this is the continuum of community engagement. This is derived from the same set of principles that I just discussed, and there's the source for it. But essentially what you can see on the continuum of community engagement, more traditional approaches fall to the left side of the spectrum, right? Those kind of traditional outreach consultation approaches, including community. But as you move toward the right-hand side, that level of community involvement, impact, trust, communication flow is all the way moves much, much higher to the level of full engagement. So as I mentioned, CERI is predicated on full engagement at all phases of the project, intending to include shared leadership, bidirectional partnership in the development and interpretation of research findings, and of the implementation and sustainability planning. And it's also predicated on the idea that this is the only method, this idea of full community involvement, to address inherent equity issues and structural racism. So that's our ideal. I'd say kind of where we are right now, we're about a year into this, in this kind of involvement, moving in collaboration. And this is where we really want to get as part of this research project. So 4 aims of CERI as it's currently funded by the county. The first one is to develop a community engagement process rooted in approaches which promote community empowerment. The second is to have a community engaged research approach to integrate community collaborators. That's the community affected, community impacted, allies, advocates, interested parties via a community partnership council. And this is your more traditional community academic partnership as a component of facilitating the process. The third aim is conducting system-wide engagement. I have no idea how this in my throat can't talk well, so I apologize. And then the fourth aim is to create a strategic plan to improve behavioral health service delivery for historically underrepresented population. And so thinking aims 2 and 3 here, as we'll see as I kind of go through these next 2 slides, is that's where these intentional community engagement pieces really are. And it's kind of like these parallel processes. Here's our first aim, community empowerment via our engagement process. This model was adapted from Nina Wallerstein and colleagues, and this is their Engage for Equity website, where they have a lot of tools around being able to build collaborative models with the community. But the idea here is to really prioritize co-learning and participation through ongoing communication and feedback loops. So that's what's envisioned in this community engagement process. And in this context, empowerment is both a process and an outcome of the community engagement. So you can see some of these outcomes here. Empowerment, power sharing, co-created definition of community need, co-created outcome measurement, capacity building, system change, ultimately for equity outcomes. Aim 2 of CERI is to develop and implement a community partnership council. This community partnership council will be a community academic partnership, which is intended to operationalize the community engagement approach. This council will have principles of cultural exchange, training and support for capacity building, is intended to collaborate on multiple co-led approaches to determine and prioritize the greatest system needs, and to undertake evaluation and feedback processes. The Community Partnership Council will engage in a collaborative planning process through the MOSA vision, mission, objective, strategies, and action planning type of endeavor. It's intended to facilitate community partner involvement in development of practical steps for measuring progress and enacting change. And it really is intended to promote community ownership of the vision and mission, aligning the group members along the way. And I will say we do not have this council in place yet. So this is a forthcoming component of the work. Aim 3 of SERI is system-wide engagement of community members. It's intended to be representative of the entire county of San Diego. That's about 3.4 million people and a huge geographic space, geographically and culturally very diverse. There are priority communities that we are intended to engage. Those communities are defined by the state and the county. Examples of those communities are historically minoritized communities, Latinx communities, Black African American, American Indian, Alaska Native, as well as communities who have been historically underserved by the system, criminal justice system involved individuals, immigrant and refugee populations, LGBTQAI, TAG groups, among others. Transitional Jews, sorry. The activities that are part of the system-wide engagement include listening sessions and forums, focus groups, interviews, and surveys. And these activities have been happening over the last 9 months in the first year of the project, and are intended to be ongoing annual opportunities for community members to give systematic input on priorities, needs for the behavioral health service system. If time allows, at the end, I have some bonus slides from our year 1 learnings about community engagement specifically that came from some of these activities that I'd love to share with you. And then aim 4 is the strategic plan. So we implement this, yeah.
Sorry, I'll give you a chance maybe to get a drink of water, and then I have a question, clarifying question for you.
Absolutely.
When you say system, and maybe this slide answers it, it looks like you're talking about the behavioral health service system within San Diego County, so including substance use services, mental health services, kind of broader, or
yes.
Can you just clarify what you mean by system?
Absolutely. Great question, Nicole. Thank you for that. And for the water, I don't know what is happening as far as fine before I started talking. Murphy's Law, right? Yes. So thank you for that. So it is system-wide. San Diego County Behavioral Health Services serves the entire county geographically and population-based. So those service systems include everything from acute crisis care to outpatient mental health to substance use, to youth programming and services, to mobile response teams that go out and deal with crises, to kind of all levels of programming that come from the publicly funded behavioral health service system. So I really appreciate you bringing that up too, because that is a key component of this, right? So this is that publicly funded component of behavioral health services. Does that clarify, or anybody else want to follow up question on that?
That clarifies for me. Thank you, Danielle.
Thank you for asking. So yes, and so the 4th aim of this is that we implement this community engaged approach to inform behavioral health services program and policy. And ultimately, you have community-driven evidence that's supposed to inform the ways in which BHS then makes decisions, right? To allocate funding to develop new programming, to remove programming that may or may not be reaching the folks that it's intended to reach. And there's supposed to be intentionally a very intentional synthesis of the input, recommendations from the input, member checking of the input that go into this process that then goes to the county. And a big component of that is ensuring then what does the county do with it, right? That's kind of one of the biggest things that the community has been asking, right? So we do this and then what happens? And so it's that bi-directional piece of sharing back as well. What happens with that strategic plan, right? So in sum, the basis of CERI is that UC San Diego partners with CHIP and with Global ARC authentically to promote community empowerment and equity, with community organizations really co-leading this process, if not leading it. And then also the community organizations and the community members, again, being integral in the development and interpretation of the findings and the implementation of sustainability. So what I come to today is the question of, is CERI effective in its approach? And as I said a little bit at the beginning, we designed this with such kind of intention and integrity around equity and kind of really rooting it in these principles of engagement. And I had a similar project in the county of San Diego Child Welfare, and I think Greg is on the call, and he was PI with me on that project, where we did, had a community engaged partnership and kind of rooted it in a lot of these practices. But ultimately, are we doing it in the way that it's intended? And what are the outcomes of that? Like, how do we know, right? So that's where this is kind of coming to, where I'm hoping to have some conversation. This quote, when I was doing some research for this potential proposal about the science of community engagement, it's from 2006. And it struck me that at the time, this quote, engaging vulnerable community stakeholders in medical research is less of a controlled and predictable science than we might wish. Nevertheless, it seems curious that we invest millions of dollars in product development, clinical training, design, and building of facilities, et cetera, but often leave vital processes of community engagement largely to trial and error. And I hope that 17 years later, we're not still at trial and error, but I do think that the science of community engagement and the understanding of how well we're doing it is really in its infancy. I think there's a lot of opportunity for us in this field and in doing this community partnered work and community collaborative work to really think about inventing the science around the engagement piece. So that's what gets me to where we are. So again, while community engaged research is increasingly accepted as essential to improving research quality and health outcomes across scientific disciplines, right? This is not unique to behavioral health or public health. It's really across many, many scientific disciplines, but the science of engagement effectiveness lags the practice of it. So effective methods for engaging and facilitating inclusion of historically underrepresented communities as study partners represent the further knowledge gap, and how to understand power sharing practices that create pathways toward health equity as another space for us to learn. So this is where I am with measuring CERI effectiveness around advancing the science of engagement. So again, while increasing the robust outcomes for us in implementation science outcomes, the study of effective community engagement is not quite there. So I'm seeking funding to support how do we know if any of this is actually engaging our partners in meaningful ways for the partners, to what regard with outcomes, and our systems making change based on these co-created learnings from the community. So the Patient-Centered Outcomes Research Institute, PCORI, over the past decade plus has required engagement in all of its funded research. And their current call, there's a funding announcement to advance the science of engagement, which addresses high priority gaps focused on the evaluation of engagement methods. They argue that no consensus exists on how to measure the variety of aspects that constitute engagement, and little systematic study has examined what engagement methods are most effective. So the long-term goal of the Science of Engagement Initiative is to build an actionable evidence base that clearly identifies the methods and approaches that lead to effective engagement, how they should be modified and resourced for different contexts, settings, and communities to ensure equity and engagement in research, and how engagement supports patient-centered outcomes research. So the call to which I'm specifically responding is the testing of engagement methods to generate evidence on the most effective approaches, particularly for understanding underrepresented populations and how this effectiveness varies by context. So which engagement methods result in high quality engagement, especially for historically underrepresented populations? So I have 3 study aims that I would like to propose as part of this kind of layered on research element of the existing SERI work. The first one, define activities and behaviors that encompass a SERI approach. And so one of the things that Corey makes very clear is that to measure it, you have to be very clear about what activities and behaviors are part of your community engaged approach. Design a comparative effectiveness approach to understand which components predict engagement success and the mechanisms which underlie them. And then demonstrate the effectiveness of SERI components via a robust mixed method approach. So the first part of this, we're doing a lot of this work already. Just need to be very clear about what are the actionable behaviors that we're going to include. The second one I'm going to come back to. I'm grappling a bit with implementation design. I'd welcome some feedback here. And I'm going to talk for just a second about the third one. So evaluation and measurement. It's required to be at least a quantitative, qualitative study. They will not fund anything that is just qualitative. And part of the argument is that in order to have advance the science of engagement and systematically understand the impacts of engagement, we have to have tools and measures that can be used across settings. So many are in development, some are already developed, but they should be easy or feasible to collect, sensitive to change, community patient-centered, and measured at multiple points in time. They have to support real-world decision-making. Where possible, they should be validated. If they're not, I'm supposed to propose a validation strategy. And I will say there are not very many that are validated already. I'm also considering a social network component, analysis component, as a method to look at the social relationships or connections and the strength of those connections and the impact of those connections on the idea of kind of a dissemination of community input approach. I'm also considering a range of potential outcomes, the quality of your engagement, right? So the engagement experience, the partnership functioning, group dynamics, the outcomes of engagement. So do we see trust among community members, for example, and researchers? The impact of engagement methods on the research process, for example, collaborative decision-making. Near-term outcomes. So timely completion of projects, timely completion of the activities. Do we have representative participants of the communities that we're attending to have involved in this process? And I think there has to be an outcome in here around how is the behavioral health services system being responsive to needs identified by the community engagement activities, or for any of us doing this work. I think that, like, how do we make sure there's an outcome in there that what's happening with the input piece, right? Is it being meaningfully used to affect decision-making in the way that it's intended? Who are the participants and what is the design? Again, would love any thoughts on this. And I have one idea, but this is so if we go back to SERI that's in place right now, we have the 2 arms of SERI. We have the arm that is intended to stand up a community partnership council and have that community academic partnership really be comprised of these interested parties, these community members who are then really part of a process to facilitate the AIM-3 activities, which are engagement in the community, right? So we have an engagement approach that you implement, and then we also have actual engagement and input activities that are being used to generate evidence in the community to ultimately affect planning and decision making. So are the participants just the folks who are involved in kind of the partnership council and the design, or are somehow the folks who are also engaged in the activities in an ongoing way part of the design? I'm not entirely sure. So grappling with that a little bit, as I mentioned. And then I came up with a potential implementation approach, and I think that Greg was on the call, so I'll be curious for sure what Greg thinks or others as well. About 15 years ago, Greg co-led a grant with Mark Chaffin right before I was a postdoc with a diffusion model of an evidence-based intervention in San Diego. And recently I wondered, could we do something similar with this partnership model where we create a community partnership council, right? And that this council is really kind of the lead council of kind of the folks who have been kind of in this space and doing this work and driving this work and calling for this work around kind of increased community engagement and increased community input, and really being boots on the ground in the community and doing this in ways that have been including folks who have not been in the conversation. And then in the second phase of this, that community partnership council becomes kind of these in vivo implementation coaches for additional council waves, right? That, I mean, San Diego is a huge area, as we mentioned, both in population and geographically. So now you have mini councils, if you will, in identified communities. And we do this until the full diffusion is achieved. And then in the third phase of this, that overseeing council shifts to a maintenance function, where you have the ability to assure system-wide authentic community input over time. So now we've put that sustainment piece in place. And we have this process that continually and meaningfully engages community in program and planning and decision making. So something I've been thinking through and also welcome some input on. Yeah, so that's what I was going to say. It's one of the things that we've been talking about on our team internally, and I saw Andy is here as well as Paul, is how do we meaningfully represent an entire very diverse county. It's very large, or service system. When I say service system, going back to Nicole's question, it's incredibly diverse, it's incredibly large, and like we are tasked with like ensuring we have community input from every possible population, right? So we're trying to think about how do we do that and how do we make sure that we're doing that well. That's kind of where I am. So bringing it full circle to some questions for us to discuss, or some challenge areas. I welcome any questions about CIRI itself, but also thoughts on the measurement and this idea of the core recall really requiring this validated measures or these kind of quantitative measures, and they range quite a bit across the domains and the number of items, and doing that with also in thinking about community co-creation. Thoughts on the possible diffusion model of a community partnership approach. And then kind of, I know that this was teed up in my talk, is like this community-led research and implementation science. By centering equity and generating community-driven evidence, what are the implications for implementation science, or what are the most important things for us to be thinking about as we do this work? So I'm going to pause. If anybody wants to comment or share thoughts, I would love to hear them.
So hi, Danielle. Hi, Danielle. Thank you for the presentation. Yeah, so just on your last point, thinking about the inclusivity in a very diverse county, I was thinking, you have your CPC approach, which could be considered like general, like overall, but then for specific implementation questions or initiatives, the project you were talking about that we did with Mark Chaffin used this idea of the implementation resource team, which was intended to represent all partners and have the relevant voices as part of the implementation process, with that goal of sustainment, right? So we're not just here to try to implement something. If this is worth doing, we want it to be institutionalized, if you will, to be ongoing, to improve quality of life and health. And the implementation resource team then, as part of what we called interagency collaborative teams, works around that specific implementing this and sustaining the specific innovation within the broader purview of the CPC. So I could sort of see it working that way. You'd have kind of an overarching big picture, but then focal teams, if you will, for specific implementation initiatives. I don't know if that's helpful or not.
No, yeah, and that's where I was kind of thinking that, Greg, and this was one, when I was putting together a letter of intent, I was really struggling with what's the design of this, right? If you're going to measure effectiveness of engagement, like, if not like I have a comparison service system, right? I mean, where I could say, okay, we're, so it's kind of like I'm trying to think through, like, how do I what's the meaningful design here? To show that this is doing engagement differently and effectively. And I haven't landed on that quite yet.
Yeah, well, I think this would be hard to do in any 4 or 5 year period. But, if you had multiple implementations, so you convened implementation teams for specific, these implementation resource teams for specific health issues or for specific evidence-based interventions you wanted to implement or co-develop, then you might over time have multiple comparisons. Similar to what we did looking at sustainment of the Safe Care Child Neglect intervention in 11 different service systems. So we were looking at what predicted sustainment, 5 to 10 years down the road. So you're sort of building cases as you go.
If I could add one thing, Danielle.
Yeah.
And this is really more for the folks, particularly if you haven't really had an opportunity to fully engage in this kind of activity. The project that Danielle is talking about is probably one of the most difficult areas to really fully have effective community engagement, because what you're really talking about is the basis of systems change. And the things that that Danielle pointed out that is really that we're wrestling with within this project is the fact that when you start to talk about systems change, it gets to the issue of power. And in this case, the way that actually shows up is really around decision making. And so when you talk about shared power, then you're talking about shared decision making. Well, shared between who? Well, you're talking about the folks that are responsible for administering these services and the community who's receiving those services. And so to bring them together to be able to move forward around whatever kind of change you had is very, very challenging, especially if you're talking about a system as large as like San Diego. The other challenge that we wrestle with is that there's different levels to this. So the question that Danielle was saying about, well, who should participate? Well, you've really got to be able to have representation from all of the elements that can actually make a decision. Because sometimes you think about, say, a child welfare system or a behavioral health system and say, well, okay, in a county, the ultimate decision makers are the supervisors or the people that are politically hired to and have that responsibility, and they do, but they're not really totally the decision makers, because you got different layers of the folks that administer this stuff, and they're not, they are kind of career folks, and then within that you've got lots of different layers of folks. So it really becomes a very challenging kind of thing to figure out, how do you bring all of these various entities together in a way that can really get to the kind of decision making that can be sustained and implemented in that way. So I'm not talking so much about the solutions to it, because we're still wrestling, trying to figure that out. But it's a formidable challenge. If you haven't done this kind of work, I think you got to be prepared. One of the things that I love about working with Danielle is she's got the patience of Job. She uses the strategies that you need to be, and you got to be quick to really adjust and move to different kinds of issues that will come up. So, and then keeping your team together and keeping our spirits high as we try to run into one obstacle after another, and you're trying to figure out how to overcome those things. So anyhow, I wanted to point that out, that when you're talking about systems change, and you're talking about power, and you really drill that down into the key thing of decision making, it's not a sense of just figuring out how to bring all these entities together, but how do you have a process that lends to a consensus around what we should move forward with, and then implementing it is another whole issue as well. So I'll shut up now, but I just wanted to point that out and saying that I admire the fact that you're even taking this on and doing this and doing as well as you're doing with it. So thank you.
Well, I appreciate Paul, the extra context and the kudos. So that's very kind. And I think, I mean, you hit on so many of the things that, we kind of grapple with in terms of thinking about the system change, the inertia, just so many things. And I think too, one of the things that even when you're talking that kind of continues to resonate with me, Paul, right? This is partly how we got here, and I got here is so much of what we're doing is like we are tasked, right, with getting folks to the table in meaningful ways and doing community engagement and community input in communities who have been historically minoritized, historically disenfranchised by either the research process or by the system, right? And so we're really working on all these fundamental things, building trust, being in community, listening. And so I do feel like some part of me wants to be, even in if I can't demonstrate system change, what is my accountability to the community say? But here is what we learned about the way your input is making a difference, or you are responding. I just wonder if there's a way of it by being included in the process, at least we're doing something differently. I don't know. I'm trying to measure the impact of what we're doing for the community as much as I am that systems change piece too.
Mm-hmm.
Does this even fit in this call? Like, is there a way, to advance the science of engagement in the work that we're doing? That can be to anybody here. Like, is there a way to layer on this extra component to say, yes, we're doing this work, and here's how we're measuring its systematic input for community?
One of the things I'll just add a point, just to cover the air a little bit. I worked with the California Endowment for the last 10 years on their Building Healthy Communities effort. It was a campaign statewide, and it was designed to bring about systems change. And after 10 years of funding significantly 14 different communities to bring systems change, what they ended up with was that the point that you mentioned about spending most of their efforts and targeting on community capacity building to help the communities to be able to develop the capacity to do strategic kind of planning and then advocacy work around that. And so the way of measuring that is still something that they're looking at, because it was kind of, they did multi-level kinds of evaluation and hitting on all the key points that you've been talking about, Danielle. But they found that if you didn't build the capacity of the community to push for implementation around the changes, that you could do all the planning that you wanted to do, but that didn't really end up in the field of what you're just talking about, of how does it really change the lives of people. And ultimately, that's one of the major things that you want to do with this kind of research, when you're talking about behavioral health and people, you really want it to be beneficial to them. But in any event, I think that's the one thing, at least, that stood out in my mind after the last 10 years of work with that effort, was the whole capacity building piece for the community. And then also trying to figure out how do you measure that in a way that shows whether you're on the right track or not.
Yeah. Well.
Danielle, I'll go back to your question about the fit with the call, the PCORI call.
Mhm.
I might have mentioned to you, but I was a reviewer for this call in the last cycle.
Oh,
And
okay.
it's a different language and slightly different kind of conceptual framework than implementation science calls.
Hmm.
Um,
Okay.
and so I wanted to go back a little bit to your second aim about the comparative effectiveness piece. And for this particular call, if I remember correctly, there was two ways that you could apply. One is you'd be developing and testing engagement measures,
Mhm.
and then the other is
Right.
to test and develop and test engagement methods. And I think you're on the, testing methods part. So
Hmm.
I'm not quite clear which specific engagement methods you're testing. I think that needs to be super clear, distinguishing them, and then but they need to have a sort of a shared outcome that you're looking at to evaluate sort of which one is um, best for whom. So, and it's tough because I think you only have 3 years for this grant. Maybe they've changed
Corey.
it.
Yeah.
Yeah.
No, but
So
Corey's 3 years. You're right.
so it's you have a lot of groundwork already, so you might already go in with kind of the specific engagement methods already operationalized.
Right.
But that's just something I think that needs to be very, very clearly articulated. And I'm not quite clear which engagement methods you're trying to compare here.
But I think that's the thing. I don't have a comparison engagement method. I think that's where I'm grappling, right? Because we have the engagement approach as designed, but I don't know what the comparison is to that yet. I'm still thinking through it. And I don't know how to, like, if we have a, this community partnership model as our engagement method and to be, have the domains of inclusivity, et cetera, and representation, but what's the comparison to not having that model? I don't know yet. So I'm open to any ideas as to what's the comparison design for that. I think that's where the struggle is, because we're already doing this one big, really big piece of it. And it feels like there's just such an opportunity to layer on to what we're doing because we're already we already have that opportunity to do it. I just think that there's just a real opportunity to think about how do we learn how do we learn the impact of it? But I haven't figured it out.
Is there a way you can use kind of all of the different levels and like the complexity of the system to your advantage? I was thinking about like what Greg said about like kind of accumulating cases and what Paul said about the complexity of the system. Is there a way you can kind of do these like small tests of like specific methods in different parts of the system or in different specific communities and kind of use that to build some evidence?
That's kind of what I was wondering and thinking about, like, maybe I didn't characterize it, or maybe my, diffusion approach wasn't, I didn't give, but that's exactly what I was thinking. Like, are there communities where you start and then kind of as you move into other communities, but set those communities up as comparison from the beginning? And or to the point of, are there certain components of the system that you say, okay, here's where we're going to focus these efforts first around crisis care, for example, right? And then we'll move into outpatient substance. I wonder if there are different components of the system. And so I don't know the answer to that. I think it's a great question. Like, I think there's definitely probably ways to think about the nuances and the intricacies of the system that would allow us to think about, are there focus areas where we could start and then kind of say, here's where we want to be now, and then here's where we can be in 4 years from now.
Yeah,
I see
some of
some
that,
comments in the chat too. Go.
yeah, I think some of the outcomes that I've heard, like who's making the decisions and capacity for advocacy, like those are things that could be common across the different systems or the different like specific things you're talking about first.
Yeah. Having difference. I am open to any other thoughts. I also had said that if we had a few minutes, I can just share a tiny bit of what we learned from the community in this last year as it relates specifically to community engagement. And then if this, like we did, half a dozen listening sessions / forums and many focus groups with priority populations and some semi-structured interviews. And really our goal of the first year of this, we had a very truncated contract year and we did not have the opportunity to stand up our partnership council, which I think is why there's still some opportunity here. We did a lot of these outreach activities and it was kind of a flurry, if you will. But I wanted to just, if we have a second, I'll just share. I'm still sharing my screen, right? One of the things that is a collaborative research team, so UCSD and CHIP and Global ARC. So this really came out of, again, our opportunity to respond to this, RFA from the county is because there is increased demand for community engagement in planning, in programming, in the way funding is allocated, right? It's always been there, right? People are like, oh yeah, go talk to the community, right? But it's always been kind of more of a check the box thing, right? Like, oh, yep, we held some listening sessions, it's done. And so there really is this more intentional, deep kind of like, no, community engagement has to be more. But then there's all like, I mean, I've been sitting in, so much of the beginning process of this is like sitting in meetings and like learning and working really hard to be in space and here. And people are like, just saying, well, community engagement, we need more community engagement. And I'm like, so what does that mean to you, right? So we really went into this first year with the goal of creating a definition of community engagement according to the community, right? That's kind of like, we want to be able to go back and say, this is kind of what we heard you say. So what does community engagement mean to the community partners? So this is the only piece of this that I'm going to share back, but the overarching theme of community engagement that came out of those kind of conversations was building trust. And that meant transparent communication, inclusivity, and credibility, right? So really came from their historic kind of experiences with either folks kind of coming in and doing research and or with the system and these things, kind of building trust. It was really key, right? So we can go back to those principles of community engagement that are defined by the CDC and the NIH, but this is what the community kind of centered, right? Which I thought was just like, it was so compelling how it came up over and over again. And so how is community engagement effective according to the community was the other thing that we like really centered on. And they were like holding engagement activities in the neighborhood and community spaces where they are, participating in existing community meetings to connect with people where they are. That is shift the research mentality. Don't expect community members to go to our externally held engagement events, right? So here's just the quote that kind of aligns with that. We just have to meet them where they are and speak their language as opposed to inviting them into our space. And then kind of this full circle, how is the input being used in program planning and decision-making and the bidirectional communication, right? For us to do effective community engagement work, in partnership with the community, the feedback to the community has to be clear and easy to understand. So it's required, right? We have to go back and say, here's what we heard. Do we hear you? Is this the recommendation that this community would make based on what we learned? And then do that in a way that makes sense. And there are some really great tools about kind of plain language kind of summaries back for community members. And I want to just close with this one quote that came from one of our interviews, but that I think really kind of full circles what our ethos is, but also kind of what our community members, when we're doing this work, right? Whether it's implementation of a new intervention or whether it's engagement of a new innovative approach, or whether it's input on kind of any one of these things we're designing. This quote says, what community engagement really where the power is inviting people into a conversation, or more you'd hope, craving the opportunity to be invited into their conversation. I think that really is because the example for years, creating a seat at the table for people. But the reality is rather than creating a seat for them, let's give them a table and hope they give us a seat at their table, because we're going to find out so much more about what works and what doesn't work. And so I just wanted to share that here because that quote, it kind of for me, as we kind of full circled and did this engagement activity, as challenging as it's been, and Paul tapped on that a little bit for us. I think we learned some really important things from the community about doing this work. And I think that's partly what's so motivating about wanting to make sure that we're using this work to kind of advance our science around how we continue to do this work meaningfully and better. So that was the last thing. I don't know if that brought up anything else. Anybody wants to share anything kind of based on what we hear from community engagement and then linking back to my previous questions or any other comments. I welcome hearing them. Examples of tools. Yeah, I have lots and lots of links that I can share back with Kira and Nicole when I hand out the the findings have not been published, but thank you for asking. We just summarized them like in the last 2 months. So hopefully we can continue to bolster them and have a robust data set to do that. Any other thoughts or feedback from me or anything else, Nicole, from you before we wrap up? I welcome any additional input. Here's my email, and Nicole shared this at the beginning as well. Yeah, I love getting to do this work, and I appreciate getting to share it and kind of talk through where to go from here with it.
Thank you so much, Danielle. This was really, really exciting and needed work. I think you'll be hearing from a lot of us. Kara is just reminding us to complete our one question evaluation. We will also be sending a more in-depth evaluation survey to all of you in a couple of days. But thank you so much, Danielle, for your time here, sharing your ideas.
Absolutely, my pleasure. I'm glad I got to kick us into the summer.